Hello, Keri here with Top of Mind. Today I'm at Interim HealthCare in Wausau on the corner of 17th and Bridge, a new location for Interim HealthCare. I'm sitting with Dr. Weber today, who's going to tell us about Interim HealthCare and some of the changes and expansion that's going on in this healthcare access point. Dr. Weber, tell me about yourself and the business here at Interim.
Keri, so I've been practicing medicine for about 15 years now, mainly in the field of hospital and acute care, where I practiced as a hospitalist. I bought Interim HealthCare about 18 months ago because I recognized that there needs to be a better care with our patients as they leave the hospital and leave nursing home facilities. And I found that not to be was lacking in our community. A little bit about Interim. Of course, traditionally, Interim HealthCare has always worked with Medicare patients and private insurance, providing home care for those patients that are homebound, both with physical therapy, occupational therapy, speech therapy, skilled nursing, and CNA work and homework as well, just general light duty housework around the house. The other aspect of Interim is that we provide staffing. We provide staffing for nursing homes, assisted living facilities, mainly in the area of CNAs again. However, we do staff a number of facilities with registered nurses. We also do private duty services where we can come into your house and staff your house with nursing therapists or CNAs anywhere from 24 hours a day to a few hours a week. Whatever your services are, we can help fill those needs. The other thing that we do is hospice care. In hospice care, we take care of the dying patient. Generally, we try to get your loved one into our hospice program at least 6 months before they would pass on, so that they can experience all the benefits that we have to offer with hospice. We have the only fellowship-trained hospice and palliative care medical directors in this area. Spirus and Ministry and Ascension do not have that. So I think we offer a great service there. Then the other aspect that Interim does that I found lacking from a professional standpoint, being a physician and still practicing physician, was our palliative care program. And what that really does is help bridge that gap of your loved one not being ill enough to be a hospice candidate, but yet struggling with chronic disease. And most often what happens is when your loved one is struggling with chronic disease, it becomes a revolving door through the emergency room every week, every 2 weeks, every month, with the same problem again, be it heart failure exacerbations or exacerbations in COPD, emphysema, diabetic problems, wound problems, cellulitis, whatever the case may be. You find yourself going through this stage, and it's very frustrating on both the family as well as it's extremely hard on the patient. They're at a point in their life where they just don't want to deal with this stuff anymore. We bridge that gap then by providing our professional services, both from my standpoint, where I'm an internal medicine doctor, Dr. Mahmood, who is fellowship trained in palliative care and also internal medicine, as well as our nurse practitioners. And we're able to bridge that gap and bring people the comfort and care that they need without having to be through that revolving door. So those are kinds of the things that we offer here at Interim HealthCare.
As far as the patient experience, the overall patient experience, tell me about your rating as a healthcare organization and what the community can expect from Interim in having you care for their loved ones.
Right, and I'm glad that you brought that up, Keri. Interim HealthCare, even before I bought it, had worked in the community very, very hard to be the best. As far as the star ratings, Medicare rates all Medicare certified programs. So that would be Aspirus at Home, Ministry Home Care, and then Interim Healthcare. Those are the three that are Medicare certified. And we have always beat the competition in terms of quality and outcomes. But more importantly, Keri Ann, we have been a 5-star out of 5-star agency as far as patient satisfaction. And to me, that drives home the point even more. And I use the example of going out to dinner. You can have a great meal and wonderfully prepared. But if the staff and the experience is horrible, you're not going to go back to that restaurant despite how good that meal was. And so it's really important for us to have continuity of care and to really drive home customer service so that our patients always feel that they're number one and that we are looking out for all of their needs, both the patient and the patient's family.
Can you give us an example of how you provide your continuity of care?
So really what we do try to do is certainly make sure that we have the same nurses coming into the facilities or into the home, as well as physical therapists. We have a program that we work with one of the local nursing homes with where they rehab total hip and knee patients after having surgery. And we'll go in there for free for a day or two prior to the patient going home so that we can spend time getting to know the patient because everybody's different and their progress in therapy is going to be different. So we go in there and make sure that we have a warm handoff with that patient and their family. We will go out to the home before the patient gets home and make sure that it's properly set up, avoiding all the trip hazards, etc., and do a lot of education with the family to say, okay, now this is what we need to do in order to make your loved one safe. And then they transition home, and we make sure that that therapist is always available throughout the therapy sessions, however many weeks that takes. One other thing that we do, we have specially trained wound care certified nurses. And like, for example, right now at Bay at Manor Care, we actually are the only ones who go in there and do all the wound care for those patients so that we're the only people, our specialty trained nurses are the only people who are touching those wounds and changing the dressings every single day. And then that coordinates back with myself and Dr. Mahmood and our nurse practitioners who are, the doctors and caregivers so that we can make sure that that progress is continuing. And if there are bumps along the way, we can intervene right away with the wound without having to send your loved one out to, a surgical wound center or someplace else, primary care doctor's office or whatever. And not only does that help in terms of making it a less arduous experience, but the quality care improves because there's no delay in care that you would get otherwise. So,
how can our community learn more about you? Where are you on a website, social media?
So we do have a Facebook page, Interim HealthCare of Wausau. We also have a website. It's interimhealthcare.com/Wausau, WI. Mainly, the best way is if there are any questions or you think, hey, maybe I'd like to see if I could do this or that, the best way to do is call us, 715-842-7707. Our staff is we have the greatest staff. Our administrators and our nurses have been with this company for decades, each on their own. They know the ins and outs. The other advantage to Interim HealthCare that you have over Aspirus or Ministry at Home is this is all we do. So if you have a special request or a special need, it doesn't take anything more than somebody saying, hey, Dr. Weber, so-and-so has a special need. What can we do for him? And we'll bend over backwards because that's all we do. You don't have to go through all the gatekeepers and administration levels that you do at some of these bigger institutions. So,
thank you for spending time with us today and for educating our viewers on all of the service of Interim HealthCare. And is there any additional comments that you'd like to share?
Just that by moving into this new location, Keri Ann, we are now able to serve a much broader net. In the past, we pretty much just covered Mosinee, Wausau, and Merrill. Now, being in the location that we're at, we can access Highway 29. We can go all the way to Owen Withy, all the way as far south as Highway 10, to include Marshfield, Stratford, and north to include Dorchester, Medford, and all of those communities. So we're really hoping to be able to spread our quality of care out to a much larger area in the community.
Excellent. Thank you so much.
Yeah, thanks.
Okay. I see what's happening, yeah. You're face to face with greatness and it's strange. You don't even know how you feel. It's adorable.